We recently authored a paper in the journal Explorer, which is going to serve as really a jumping off point for what I'm going to briefly talk about. So I would encourage you, we put in the chat list over there a bunch of resources, one of which is a link to this Explorer article entitled Whole Health Learning, the Revolutionary Child of Integrative Health and Education. It's a short article, so I would encourage you to read it. There's an open access link for at least another few weeks. After that, if you need a copy, let us know. So we started from this perspective and from my background in health, looking at the state of children's health, which is in many areas, particularly in emotional, mental, and behavioral health, worsened over time. Anyone that works with kids in healthcare or in education understands this in terms of chronic illness, but particularly in terms of mental health. Kids are struggling, and particularly those who are victims of adverse childhood experiences and that kind of trauma. The current situation with COVID, but not just COVID, all of the other equity issues, racial justice issues, all of the great fear and polarization in our country has only served to make these problems much, much worse. And we are seeing an exacerbation of emotional, mental, and behavioral health conditions that are through the roof. We're seeing visits to emergency rooms not increased for physical health reasons or for COVID reasons for kids, but because of domestic violence and abuse and anxiety and suicidality and depression and so on. So we've taken a difficult situation, it's gotten worse, and there's been a disproportionate impact just like in terms of the health issues, in terms of the emotional and mental health issues as well for certain groups of kids. All of which brings us to what are we doing here today? You know, what is our role as people in education and in health fields? Why are we trying to take these two areas and mash them together? There's been a long, rich history of providing health creation opportunities in schools. It's been, all of you out there that have been doing this work for a long time understand this, but it's been really difficult to sustain. So we took a look at really when we go back to the purpose, what is the purpose of healthcare and what is the purpose of education in schools? And as Taylor said, what if we could, through the lens of social emotional learning, take all of these amazing programs that are out there, help to coordinate and sustain them? What great impact would we have for kids' health? And I have argued, and we argue in the article, that there is probably no more effective, cost-effective, and accessible way to do this than infusing these kinds of programs and principles in an educational setting. And that all sounds great, but it requires an incredible investment in infrastructure for our country's future at a time where the needs right now for everybody are really, you know, almost really basic. And we understand that schools are struggling with even whether or not to open and how to teach if they can't teach in person. So that's the background that we come together today. I do want to read to you just a brief paragraph from the article because I think it puts in context our vision for where we think this needs to go and the level of commitment that we're trying to raise and put forth. So in 1997, almost 25 years ago, the Institutes of Medicine in this country put forth a report entitled Schools and Health, Our Nation's Investment. And they warned us, they said the schools of yesteryear were not expected to solve the health and social problems of the day by themselves. The medical, public health, social work, legislative, and philanthropic sectors all pitched in. Given the scope and complexity of the health problems of today's children and young people, it is again likely that the schools will not be able to provide solutions without the cooperation and support of families, community institutions, the healthcare enterprise, and the political system. Remember, this is from 25 years ago. A strong interconnected infrastructure will be essential if coordinated school health programs are to become established and flourish. And I would argue that there is no more needy time than today. This stands as true as ever. And we hope that the work that we're talking about doing here today and in the future can finally help to get some traction in these areas.